just treat people like they're the individual and how we can set them best up for success no matter what.
You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers! Today I chat to registered veterinary technician Beckie Mossor. She is based in the United States and is in North Carolina. She is the owner of Veterinary Advancements and also is the co-host of the podcast Veterinary Viewfinder. She gives us tips on consulting with clients that have special needs, and I found this interview so interesting. Beckie's advice and tips made me feel so much more confident and prepared to communicate and serve these clients so much better. For those of you that join me every week listening to my podcast, a big heartfelt thank you for your continued support. But if this is the first time that you're listening to my podcast, I just want to say a big welcome and want to let you know about our amazing vet rehabber community. If you haven't already joined us on Facebook, we have 4 amazing online communities. They are called the Small Animal Vet Rehabber, Hydro Vet Rehabbers, Equine Vet Rehabbers, and the Business Vet Rehabbers. And that one is for those of you that are running your own practices and you're looking for tips and advice on growing a successful practice. So before we join Beckie, a quick word from our sponsors. PulseVet are the global leaders in veterinary shockwave technology. They manufacture the ProPulse and Versatron family of products. So for those of you that don't know what shockwave therapy is, it is a non-invasive high-energy sound wave therapy. It can be used on both large and small animals and to treat multiple soft tissue as well as musculoskeletal conditions. With over 20 years of clinical research, PulseVet is used by the top veterinarians and vet rehab therapists to improve quality and speed of healing, to relieve pain, stimulate bone and tissue growth, and improve mobility for their patients. For more information, you can go to pulsevet.com, and you can also meet the PulseVet team at their virtual exhibit stand at the Vet Rehab Summit in November. This is November the 14th, guys. This is our online veterinary rehabilitation conference. One day, it's going to be absolutely amazing. You don't want to miss it. So over to Beckie. Thank you so much for joining me.
I'm excited to be here. Thank you so much for having me.
Beckie, tell us a little bit about yourself and your experience with people with special needs.
So I am a registered veterinary technician. I live in North Carolina, USA, and I've been a technician for about 13 years now, licensed technician for 13 years now. And back in 2015, I made some transitions in my career out of practice and started working with a service dog training organization. And when I started working with service dogs, I started to work with obviously clients who had, different able needs and different facilitation needs. And I really started to become aware of how we are not super aware of that in the veterinary industry and how we work with our clients. So I kind of had this bridging space where I had clients not in the clinic and clients in the clinic, and I was seeing sort of how maybe we weren't serving them as well as we could have been.
Yeah, I mean, if I think back to when I was in practice, you would often I'd have maybe clients that are poor of hearing, maybe ones that they were blind or had poor sight, and I must say it was a little bit awkward because you don't see it often, and we weren't really taught how to handle the situation, and especially think in the rehab scheme of things, where we really are relying on feedback from owners. Sometimes you don't really know what to say. If there is someone who obviously has poor sight, then are you seeing a difference? Those kind of things. You've got to really think about what you're saying. And if I think about it now, I often relied on the person who brought them into the practice,
Yeah.
So I ended up really talking to them. And the more I think about it now, the more I think how rude that was and how, I actually feel bad about it now. Only after you and I had that discussion about it, I thought to myself, well, we actually really need to be aware of this. And these are cases that us vet rehab therapists are seeing because they are super important to these clients. So what are the types of special needs that we might see in practice?
So I think the first thing to remember, and I'm not picking on your words, I think it's a good example of the way that you asked that, is that most disabilities are invisible disabilities. So you won't see them at all. So you have to be thinking about your clients who are maybe claustrophobic, maybe your clients who have traumatic brain injury with memory issues, maybe PTSD. I mean, really, truly, just as little as closing somebody in an exam room and not giving them the option to leave a door open or to wait in the lobby. So we have to remember that for the most part, the disabilities that we quote unquote see, we won't see. In addition to that, there are obviously mobility issues, and those are going to be more visible, and we can see that. Visibility issues, so we have clients who may be blind and who utilize a dog that helps them for that. Hearing issues are also very common, although not as common with the use of service dogs. And then, we think of things like epilepsy or migraines and things like that, where we have a dog that services the client who is doing perfectly fine all the time, but has a medical condition that we may even need to be aware of to respond to at the visit.
Yeah, so I must say, I didn't really think about, I mean, to me, it's like the obvious things, so the things that we think of as in sight issues, hearing issues. I did think about epilepsy and things like that, but I've never thought about people that are maybe claustrophobic, and somebody who is claustrophobic. So like I can actually have a panic attack. Like I've been known to walk up 20 flights of stairs so that I don't have to go in a lift. But in consults, I just never think about it. You're just there and you're just focused on that pet and you don't ever think about it. So if it's one of these kind of things that we're not, it's not visible, how do we know that it's happening if they're not telling us? How can we be aware of these, that there are people that might be having these silent disabilities, which we are completely ignoring?
Yeah. So the number one thing is it's funny because very much like with COVID, everyone said, assume you have it, right? Now we have this Black Lives Matter movement going on, and they're saying, assume you're racist. Like, just assume it's a problem. So what I tell people is assume that your client has some kind of disability of some kind or another. Over, like 1 billion people throughout the world are registered, right? Like recognized as disabled, and that doesn't include our mental health disabilities. So when you look at those kind of numbers, just basically almost everyone on your staff, you and your clients, someone is going to have some kind of different ability. So it starts with asking and not assuming, no matter what it is you're doing. Are you fine waiting in the exam room, or would you like to wait in the lobby? Are you fine waiting in the lobby, or do you need to wait in your car? Are you fine if I close the door, or would you prefer I leave it open? It's truly just it's getting in the habit of, instead of just doing the things that you're so focused on, just opening that awareness and saying, are you comfortable if I do this? And when we have clients with very visible disabilities, right? So like what you did is very common. When we have a client who maybe is deaf and doesn't, maybe utilizes a sign language or an interpreter, we have a tendency to speak to the interpreter instead of the individual. And the biggest problem in our society globally is that individuals with disabilities are already invisible. They already feel invisible. They already feel overlooked. And so when you have that conversation with the other person, they probably are sitting there thinking, this is my dog. I should be a part of this, but they're so accustomed to being overlooked that it's an everyday thing. So it comes down to slowing down, being aware, asking questions, and then finding the ways to be completely inclusive. And if you are uncomfortable, the best thing I can tell you to do is to say, hi, I'm uncomfortable. Because they already know. They live with this disability. They know people get uncomfortable. It's not an elephant in a room. I'm really sorry. I've never had a client who was completely blind. Please help me know how I can give you the best experience here. They're going to appreciate you addressing it instead of pretending you didn't notice they're blind so much more. Does that make sense?
Yeah. So just be more real and just say it how it is. Yeah.
Yeah.
You made me feel really bad now about
I feel so bad.
So I say that. I said it was always on the first consultation where it was. And then eventually you get to know that person, and then you get to know what they're capable of and what type of communication you're able to do with them. And then when you need the interpreter, and there are times that you don't. So I think that we get better at it, but it's always that initial one. You just like, how much are they going to understand, and how am I going to do this?
Yes. And so first of all, I want to say, don't feel bad, because you do the best you can until you know better, and then you do better. So you're already doing better because you're getting the message out, right? What it comes down to even then is asking and saying, I have a lot of observatory information I need in this first visit, and so I'd like to include you both in obtaining that information. And then I would leave the opportunity for my owner to say, well, obviously I can't see, so I'm going to ask my sister, and like let them push it over to the sister or to the person who brought them to explain the observance. And like for me not to assume that they don't want to convey it, because what if they have a conversation every single night about the dog and how they walk? And like, what if they have a process that keeps them a very part of it? Or what if they have some beautiful way of knowing that their pet is not doing okay with the skills that they have? I want to tap that first, and I'm going to let them default to their backup.
Yeah, so I mean, if I think about, let's say, for example, somebody who was blind, we really want to get their feedback. And so, like, one of the things maybe we could do is actually ask them more specific questions. So, like, instead of like saying to our clients, how's it been going for the last week? How has he been sleeping the last week? Has he been moving around or getting up and down? So maybe being more specific so that they can actually be able to answer it, because it might not be something that, they'll perceive as, when you have somebody who's able to see.
Yes. And that's exactly right, because just because they can't see does not mean they don't observe, right? So I will say, what do you observe in the changes? Because they're going to be listening to their pet's gait. They're going to say he's panting a lot more or shifting a lot more, because they have different ways of knowing their pet, just because they can't use what we go for first and foremost because we can. So I still use words like observe. I just don't use words like see. But you're exactly right, making it very specific. How's he sleeping? You don't have to see your dog to know how they're sleeping. I got a pit bull that you can tell is sleeping fine from the next room because she's sawing logs. So it's easiest saying to, if you have a client, again, who's blind, you just say, how do you observe your pet? Tell me, what do you do? How do you know there's a problem going on without being able to visually notice these changes? What do you do? Because again, they know they're blind. It's like, it's not like you can't say it, And so you just say, like, without being able to see your pet's gait, how do you know that there might be pain? Learn from them, and then use the tools that they're using and work with them.
I can remember that being so tricky, and obviously getting their hands on the dog and trying to show them and explain to them what I'm doing. And eventually we got it. But those are the kind of things that you got to think about. So like, how can we include the clients? Because what you don't want to do is just speak to the person who's there and then they're the ones who are doing it, because the client actually wants to be involved, right?
Yes.
Their pet is important in their life, and they want to be the ones, if they can. I mean, there's certain things we can get them to do, obviously, and there's certain things that we can't.
Yes, and that's exactly it, because they have adaptability. There are ways that they get through their entire life without seeing or hearing or whatever the skill is, and so, or whatever they're lacking in that ability, they're going to make up for everywhere else. Again, a part of it is facing the awkwardness. I think that's the number one thing we can do, is just say, I've never worked with a client who's blind before, and I would love to help you be able to do these exercises at home. What's the best way for me to get you comfortable? And then I'm going to hold your hands and put them on your dog. It's awkward. It's going to be different, but I mean, again, okay, the second thing if number one, we're creative, number two, we're awkward. We can work in all kinds of awkward spaces and places and weirdness. Like, it's fine. You just have to make it not awkward, because it's awkward for us. And that's partially just with the bias, right? That comes with because we don't talk about disabilities in our society, and it is a stigma, instead of just making it like a really normal thing, which is just like, okay, you don't use your legs, but you use a million other things to be creative and fun and amazing. And I'm actually going to learn from you here. So part of it is just saying, you know what, this isn't awkward. This is a person. And I'm just going to face what I feel is awkward and be honest about it. And they're going to be so appreciative of your honesty. And instead of trying to pretend it's not a thing, saying, hey, how do we make this work? They're going to be so like, once you kind of like nip that awkwardness in the bud, it's like better, you know?
Yeah, do you know, I think one of the things you think that you're doing when you're not mentioning it is not pointing it out, you know, so you
Yes,
think like, let's not make a big thing of it, and let's just avoid it and not point it out. But by actually doing that, you make the whole situation worse and
100%.
even more awkward than actually
Yes.
just saying, all right, this is the situation we're in. How can we work together and how can we manage it? What can we do that we can include you and we can, yeah. So
Yes.
I get it. Yeah.
100%. Yes. And they'll, like I said, I think most individuals, because like if I went into your clinic and you knew me and I broke my arm and it was all in a sling, you would, knowing that that wasn't my life condition, would say, oh, geez, how can we make this work with your broken arm? Right? You would call it right out and not
Yes.
even feel awkward. We don't do that. Say, how do we make this work with your wheelchairs? Or how do we make this work with the fact that you can't hear or see me? I mean, we still want to be gentle and kind about it, but like we don't pretend it's not there because it's there. And that's a big, I think you're right. We try to do that to comfort people, but it's not comfortable.
Yeah. And I think certain, I mean, definitely for me, like people that are deaf and people that are blind are a little bit more difficult than someone's in a wheelchair. And maybe
Yeah.
that's because we deal with mobility and we deal with wheelchairs, you know? So like I
Sure.
have an understanding about somebody who can't walk because I treat dogs that can't walk. So like that seems like a little bit easier for me. And to be honest, I haven't really even thought about like the people with either claustrophobic and any of those kind of things. And I can't actually recall ever, but maybe I just didn't know having any clients that I probably was just, you know, I just carried on doing my thing and I was completely unaware of it.
Yeah.
Yeah.
And that's the thing is we often feel awkward with our own discomforts, right? When we have an accommodation we need, oftentimes we suffer rather than ask for it, right? So we'll say, oh, and no, you know, oh, they close the door and we don't say anything. And then we sit there and we feel panicked. And here's the thing. You already said that you said part of this already too. You talked about how we just go in and we talk and we do our thing. At the end of the day, no matter what abilities you can see or not see, there are 7 different learning styles, and it's argued that there's up to 12. Okay. Our tendency to go in and talk to our clients is a problem in the first place. We need to assume that people don't all learn by listening, because most people don't learn by listening. How often have you said, like, for me, I'm always like, I learned by doing. So you can train me all day on how to wrap this pack verbally, but until I actually do it, I'm not going to know how to wrap a pack. Because of that, honestly, we really need to treat all of our people that we see on a day-to-day basis as if they have some kind of difference in learning, whether it is they would like, we have to set everyone up for success. Does that mean, I guess is what I'm trying to say. So like asking these questions, are you comfortable with the door closed? Do you prefer I leave it open? Put something on your check-in sheet that just says, do you have any accommodations we can use to make your visit more comfortable? Asking, are you comfortable? And one of the major things I tell clinic owners to do, clients or practice managers, move through your clinic as if you had every disability you can think of. If you were claustrophobic, if you had sound sensitivities, if you were autistic and light and sound were bothersome to you, if you had arthritis, could you sit in the chair that's offered in the exam room for 10 minutes and would you be comfortable? Can you sit quietly in the exam room? Are the fluorescent lights buzzing and making an awful sound in your ear? The thing is that there are so many levels of abilities and disabilities and differences that we can talk about the big things like being blind or deaf or in a wheelchair all day. But the truth of the matter is that most people are uncomfortable in some way, or we're not setting them up for success in some way because we don't ask, we just assume. And because we just kind of like, we talk to you and then here's a worksheet. We don't think about different learning styles and how to include our clients no matter what. And I think that just assuming that everybody's going to learn differently across the board and not worrying about why or what wheelhouse they fall into is like the best way to go about client service, because then we're just treating individuals always. And that even I think goes for our staff. We're asking, how do you learn best? How can I help you be set up for success in this? We just get in the habit of accommodating the person in front of us. You rehabilitate the dog in front of you. If I say this dog has, you know, a collapsed disc dachshund down in the back end, you have a list of things you're thinking through, but you wait until you see that actual dog to make the decision of what you're going to do. You treat the individual. Well, all your clients are individuals too, so communicate with the individual.
I like it. So basically, we never ever assume that anybody, that we assume that everyone has some sort of disability, right? So, and when they come in, basically, we need to be thinking all the time about how they are and if they're comfortable. And I like that. Put something on your check sheet. Ask them straight away. Give them the opportunity to say to us, actually, I'm really claustrophobic, and the fact that you closed the door is making me feel really uncomfortable. So give them that opportunity. Don't just go in there and just start with the dog straight away. Speak to them, look at them. So yeah, I really like that. And just assume that everybody at some stage maybe there's something going on with them, even if it's not visible. And then if there is something that's visible, or if they do then talk about it, say it how it is. Say, acknowledge whatever it is that they've got, and then ask them how we can actually help them to be able to either communicate or work together.
Yes. And then the last thing I would say on that is medical devices are extensions of a person's body. And so we would never put our hands on a medical device without asking, just like we would never put our hands on a person's body. So, asking if they would like help. Don't assume a person needs you to get the door for them. Don't assume they need you to do something. Can I help you with that? Don't ever put your hands on a person's wheelchair or move them or any of their medical devices without asking permission. It is an extension of their body, and that's an incredibly important sensitivity to have.
Yeah, I think that just goes with asking all the time. Like, would you like some help to get out? Was someone going to come help you? What would you like me to do?
Yeah. Because sometimes people don't want help. They're like, I got it. No. Or like, thank you. It would be very helpful. You don't have to have a disability to have a bad day. You don't have a disability to need some help, and you don't have to have a disability to just need someone to accommodate your additional needs. Because at the end of the day too, we're at the vet. It's stressful. I'm a veterinary technician. My dog had a UTI the other day. I had to take her to her vet. When I got home, I could not remember how long they told me to give I couldn't remember anything they told me because I was so worried about my dog. And as a veterinary technician, to have those memories of I'm a client right now, it's so important. So asking them how I can best, do you want this in writing? Should I send you an email? Whatever it is, just treat people like they're the individual and how we can set them best up for success no matter what.
The last thing I was thinking is to ask them, how do you want me to communicate with you? So especially like the person who's hard of hearing, would you like me to SMS you? Would you like me to email you? So basically asking them, and the person who's blind, obviously the phone, but just ask them, how would you like me to communicate going forward with you if that communication is a tricky one for them?
Sure. And I think that of anybody, right? Because again, some people read and retain. Some people are like, oh, it would really, really help if you did that. No, this handout's plenty, whatever it is. And that's exactly right. Just saying what works for you and not assuming. I also like to mention this just in terms of practice management in general. We have very few practices out there who do have text message appointment setups and alternate setups other than calling and being on the phone. And I do think that this is an area the veterinary profession could expand and do a better job to accommodate people who either just have, social anxiety and picking up the phone and calling is incredibly difficult, all the way through to hearing impairments, speaking impairments, where being on the phone is very difficult, and it may actually cost you money to make a TTY phone call. So I think that we need to really be expanding our practices to ensure we're accommodating everyone.
Beckie, great advice. Thank you so much. I actually feel so much more comfortable now with all those tips that you've given. So the next time I have a client who has any disability, whether I notice it or not, I feel a lot more prepared. So thank you.
You are so welcome. And that's the best thing I could ask of this is just to make it a little bit better world. So thank you for the time to get this message out.
Thank you, Beckie. Take care. Bye.
Bye.
If you enjoyed listening to this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about veterinary rehabilitation. For more information about continuing education for vet rehab therapists that you can do online, you can go to onlinepethealth.com. I'd like to thank you for listening to this podcast and, of course, thank our sponsors, Pulse Vet. We thank them for their commitment to their mission to improve the quality of life of the animals that we all love by developing, validating, and providing advanced shockwave therapy at the highest level of support and service. Remember, you can reach them at pulsevet.com or info@pulsevet.com. See you all next week.